Remi is a cost savings alternative for OEM service contracts, or any service contract for that matter. As you're probably familiar, service contracts are very lucrative for the vendor. We always refer to them as the diamond earrings with the dress. And they look like this, just a small sample. Typically it's way more than just an envelope. But we go from multiple contracts with multiple vendors, multiple expiration dates, and multiple payment plans to a single contract with Remi. To go from multiple contracts to a single platform with Remi is roughly a 20% savings on your entire service budget on the applicable equipment, or for the equipment that you choose to put on the program. The program is not an all or nothing program. When it comes to service, we recontract back with these vendors on an as-needed basis. So it's a very simple process to move forward to take a look at the program.
I think everyone should consider using Remi simply because our time is limited, our dollars are limited. Let somebody else do that for you.
Well, I definitely would encourage them to check it out because I think there are some savings to be gained there. I think it's a good alternative to the OEM service that you might get from the manufacturer, which tends to be a little more expensive.
I have actually spoken with a few that have called me about Remi, and yes, they're so far, like I said, this past year has been excellent, no problems. Ease of getting our vendors, ease of calls, ease of returns, emails have been right spot on, or questions about adding equipment have been quickly taken care of. So
the main reason I can say using Remi is to save money.
Remi's retention rate as a company is over 95%, between 95 and 96%. This is my 19th year with Remi, and I'm also proud to say that I have never had a hospital leave our program. So I have roughly 100% retention rate. Once someone contracts with our program, they are on that for 19 years and counting.
So I definitely would recommend give Remi a chance. I think you'd be surprised and getting the same level of service plus a little bit of savings.
And they do act on your behalf. They're don't have anything to gain from these vendors. They're truly a service for the hospital.
End-of-life strategies is what I would say is number 2 of one of our biggest and most popular service offerings. We're doing this in Kansas, I would say, on a weekly basis now. I do it on a national level on a daily basis.
It was about 2 years ago we've been made aware of Remi, and we were using a company called Thermo Fisher for some of our maintenance insurance for a couple of pieces of our equipment. And they sent a letter out saying that they were no longer going to insure or be in the business. So that gave me a chance to see what Remi could do, and so we did quote them, and they saved us about 20% actually on our existing price that we were paying, and using the same vendors as we were previously using. So it was definitely a win-win for us.
What end-of-life strategies are is when you have an older piece of equipment that's mature but dependable and still meeting patient care, often getting service and parts can become complex. Certainly the large OEMs, again those would typically be GE, Philips, Toshiba, Siemens, are going to want to promote new capital asset purchases. Through Remi, over 90% of the time we're going to be able to keep an older mature piece of equipment up and running for years. So in some instances, even 8 to 10 years after the OEM deems that equipment obsolete. So Remi will never come to you and tell you that you have to keep a piece of equipment in service, but you have that option now. So where the OEM might come in and deem a piece of equipment obsolete, looking for a capital asset purchase, Remi would come in and be able to give you a heavily discounted service contract and hook you up with a strategic service provider to work on that equipment the majority of the time. I'm going to say easily over 90% of the time.
We had our injector for our CT machine was one of those pieces that works very well, continues to work very well. And they no longer were going to service that piece of equipment. So we thought it was going to work for us. It was a good piece of equipment that had some years left on it, and we were happy to have Remi quote us and put it on to their list, and we continue to use that piece of equipment today.
So what I always encourage new clients is if you have equipment that you feel like is being deemed obsolete, to submit that to remi, and you should have high expectations that we can come up with a good solution. Yes, you can continue to use the vendor of your choice. You'll always have vendor of choice or freedom of choice.
We are seeing the same service people that we've always seen.
You actually should not expect to see any delays in service.
Service level and response times have been excellent.
You're able to use the current vendor that you're currently working with.
Seen come to our facility, really no drop off in service or service times. It's been very consistent, and we've been very happy with using remi so far.
In talking to the lab or the x-ray where the majority of these contracts are going, I have not seen any detriment or any problems with getting the service from remi.
As a matter of fact, of the large vendors, GE, Philips, Toshiba, Siemens, we did over 10,000 repairs with them last year alone.
We have had no issues. We call, they're here, same reps, same vendors. It's been excellent, so I have no complaints at all with that.
It's been all positive.
Also, remi has a 24/7, 365 dispatch center that works directly with the OEM, so absolutely you shouldn't expect any delays in getting in contact with us for service, and then we have relationships with all the OEMs, major OEMs, to provide service as well.
We use the same vendors. If we request a different vendor, they look it up and find one that's nearest to us, but normally we just keep what we know. The comfort of the same vendors.
Again, no problems getting the exact same people, so I think that's made the ease of changing and using remi excellent for us. So.
My managers and directors haven't even noticed that we switch service agreements. It's just so easy.
I think our service level has increased from the vendors that we already had relationships with. I think remi carries a little more weight than small rural hospital does. I've also been able to leverage the current vendor to improve our service.
We do have preferred providers throughout the country, so if you're not happy with the current vendor that you're using, then we'll be able to supply you with someone to service the equipment. Often the service that you get from the large manufacturers, GE, Philips, Toshiba, Siemens, is only as good as your local technician. So there's good technicians in certain areas of the country and then not so good in others. So you have the flexibility to use who you're currently using right now, or if you're looking to change to someone for different reasons, then we can provide you with that as well.
I also had the situation today was that I went to remi and said, I'm really unhappy with my current vendor. I don't want to use them. And they said, fine, we'll go directly to the manufacturer and get it done. It's been a great improvement.
Well, remi has helped us reduce costs by cutting our costs down by about 18%. I mean, here at our hospital, we were spending over $250,000, and we're just a small hospital, on maintenance contracts. We were looking at insurances to cover it or whatever. And
there's a couple of ways that we're able to reduce the cost. One is through economies of scale, and then also a term that's called spread of risk. So an easy example is I'll use GE as an example on a CT scanner. So instead of paying GE $100,000 up front, on January the 1st, not knowing whether you would need them or not, then we start down here and we pay GE on your behalf for preventive and corrective maintenance. Sometimes we'll actually pay more than what the vendor was charging in the first place. However, through spread of risk, so we're not just taking one piece of equipment, we're spreading that over lots of different modalities in a single hospital and then with several hundred hospitals across the country. So with those two laws, I guess, of economics, by changing just the economics of how you purchase service, we're able to achieve roughly a 20% savings, 15% guaranteed through KHA on applicable equipment to the program, which is going to be over 90% of the clinical equipment in lab.
Cost savings that they're able to leverage for us. But the other thing is just the time that I'm saving. I don't have to go to multiple vendors and get pricing from them. Remi takes care of that for me. If I don't have a preferred vendor that I want them to go to directly, then they're going to go to the market or deal with their preferred vendors. But the big thing is we've found across the board, anytime I send a contract to Remi, they're able to reduce costs for us. And I can tell you just today, I did one for our CT maintenance contract, and it was about a 20% savings. It's kind of a no-brainer thing for you because your service is better and you save time.
It's preferred for you to gather all your contracts that you would have in the hospital to get a global spend. So our hospital is spending this much on all our contracts, and then we'll be able to come back and show you a global savings. And then we move to what I call a priority schedule, or it's actually a rollout schedule.
And then they sent us a very detailed sheet as to when our contracts are up, the dates of it, how much their costs are compared to what we were paying. Could we use our own vendors that we were using before, which was very great. We can still use our own vendors, which is a big plus for those, so that it doesn't scare the people that are using the equipment, that they're familiar with the people that are repairing it, which is a very good thing. So it took about 2 weeks to get that done, that process.
Well, I've done it two different ways. I've called them and talked through our needs and given them the parameters. I usually send them a Word document that said, here's what I need, and then they shoot me back, and we're talking 24, 36 hours total. I've also sent them the proposals that I have already in hand. They can evaluate those, help me do side by side, so I don't have to do that. I don't have to waste my time doing that. They'll do it in exact format that I already have the proposal in. And again, it's still 24, 36 hours. So depends on your comfort level, if you want to share what you have versus if you just want to shoot them. I've even done it when I didn't have a proposal, another proposal. I just give it to them originally and say, give me a price. And then I might go get a proposal and look. So the vendor knows I've already talked to Remi, but I'll always go with Remi before. Their customer service is so much better that I always prefer Remi.
When we first started with Remi, we submitted all the contracts that we had paper-wise. We scanned them and then sent them to Remi through email, and they sent us a proposal back. I have a copy of the original back here, and they told us what they could do and what they could not support with our equipment, and they were very honest about that. So they worked real well with us. We enjoyed working with them. And the people that I talked to were very, very friendly.
Well, what I normally do, I just send our old service agreement to my Remi rep, which is Jimmy Williams, and I call him up after I email him and let him know, hey, I just submitted something, and within a day or two he responds and he gives me a contract or a service agreement with the same exact terms, and there's always a drastic percentage drop in the prices.
Okay.
Our average turnaround is 2 weeks, but certainly we can do things quicker in certain instances. So anytime that you have a service contract that you would like to have reviewed is a good time to send it in to Remi. However, most often with the new program, you're probably going to be in a position to send me what's currently on your desk, and it may be a little bit late in the game. So anytime that you have a service contract you'd like for us to look at, you can send that directly through us, through the KHA@theremigroup.com, or to me direct as well. We'll get it submitted.
I mean, I even had a situation with our servers that the service agreement got passed around to different people before it got to me, and 2 days before it was supposed to expire, it was given to me, and it was like, hey, can you get Remi to do this? I mean, and they really got it done, and we still got a drastic price cut. So I was very impressed. At that point I was like, okay, this is it.
Remi has been around since 1998. We started with 5 employees. I actually was the 6th person to come along and start representing Remi. Now we are well over 100 employees. We're nationwide, heavy on the West Coast, heavy on the East Coast, heavy in Texas, and then in the middle. We're becoming heavier here in Kansas as well. In-house reimbursement is a very simple process for the repairs that your in-house technicians would provide on the equipment that we cover. We will cover them at an hourly rate negotiated through KHA at $100 an hour, plus the parts. So providing coverage for the labor is one thing, providing coverage for the parts makes it much bigger savings opportunity. So if you have in-house technicians that can work on the equipment that we cover, would want you to make sure and encourage them that we are in no means looking to try to outsource them. We actually encourage in-house repairs. We insulate, support in-house services, and reimburse for not only the labor that they do, but also the parts. So a lot of times in the healthcare industry, there's a term called ISO, which stands for Independent Service Organization. Companies that are known as ISOs in the industry would be companies like Airmark, Sodexo, Crothel, Trimedics. There are a couple more companies that are coming into that industry, but you also might have regional ISOs like Central Kansas Radiology, or examples like that. So where working with an ISO can be part of a solution, ISOs can never work on all your equipment. A lot of times, most easily, lab is left out of this equation. And a closer look at ISO contracts, you might be paying cost plus for pass-through contracts. So with remi, compared to an ISO, we're more broad because we don't have to have a service technician for all the equipment because we recontract with the manufacturers. And also, we have a very high success rate of offering a higher savings than the ISOs can because we have a lower expense ratio without the employing the technicians. So I would say, especially for larger hospitals that may be contracted with an ISO, remi is still an option that you should consider in comparison, not only financially, but also for flexibility to cover more modalities than the ISO would currently be covering.
Our existing rad rooms, we have a GE Proteus and a Siemens Fluoro machine that are under remi. DEXA has just been added, that is a GE machine as well. We have our power injector, which is a Mallinckrodt power injector and CAT scan that's on remi. Our C-arm and our portable are also GE pieces of equipment. They are on remi as well.
We've done our IT servers, we've done CT, our lab, our radiology, our anesthesia, anything that you can put a service that has a service agreement, they cover.